Hi, this is David Schwab, and welcome to the iADS Member Spotlight. Today, our guest is Dr. Jack Krauser. Dr. Krauser, how are you doing today?
Excellent. In fact, I'm almost getting used to this quarantine.
Tell me just very briefly, I think a lot of people know you, but a little bit about your background just for a minute, and then I want to hear your opinions on some things, please.
Sure. I grew up on Long Island, and my childhood dentist and childhood orthodontist, I actually enjoyed very much. So I had no big phobias towards dentistry. Both of my parents were school teachers. My father was in high school, and my mother taught elementary. So I think it must have been in my genes that I would become an educator as well, which I love as part of my career. So when I left high school, my intention was to become an orthodontist. I attended the University of Connecticut mainly because I wanted to go to the University of Connecticut Dental School, which was sort of near Long Island. Connecticut, Long Island touch each other. However, I was playing lacrosse, and a couple of my teammates went to the University of Pennsylvania. So when it was my chance to get into dental school, the the guy that came around introducing the school to us, I talked with him a little bit, and he invited me for an interview, and I became the third in a succession of lacrosse players that went to the University of Pennsylvania Dental School, which turned out was very instrumental for my career. I was completely blown away, almost to tears, when I saw Mort Amsterdam showing what can be done with periodontal prosthesis in the first week of my dental school training. It was almost then, but maybe within the first year, I decided that I prefer something to do with perio rather than orthodontics. I then went on to Boston University, mainly because I heard of the excellence in surgical training that was able to be obtained. So I went up to BU and I studied with Kramer and Evans, and it was quite a rigorous program.
That's really, tremendous background that you have. And then how do we deal with some of these issues today? You've got this fantastic background, and you certainly know all the stalwarts in dentistry, and they were your mentors. So where are we going from here?
The way I see my practice and many other practices, it's the famous architect, Mies van der Rohe, less is more. And I believe that if we are going to control a smaller practice, a more one-on-one experience with a patient, and if we have to have much more PPE equipment, and we have to change the room very vigorously, and we need 15 minutes in between patients, this could actually be a tremendous boom to the way we practice, in that we're giving very specialized solo patient-to-patient care. Now, I've been doing that for the last couple of years anyway, so I think I'm actually prepared to do that, and I'm very excited to develop this concept and see how it goes forward.
That's really interesting. That's great insight. And the fact that you can actually see a positive coming out of this, and I think you're right on. Let me ask you this question. We've only got a minute left. You sort of gave us the perfect transition into iADS. So where does iADS fit in, and what's the value of iADS going forward?
When we had opportunity to help Alan Farber launch, I became a life member. And I kind of make a joke out of it when they or he asks, what do you really want? And I said, I just want 3 more months on my membership. About that. But iADS is, in one way, hanging on to the traditional referral interdisciplinary approach to perio that was there in our career. But I also think it's going to be a possibility to be there, if we choose as an alternative to be more solo and taking everything in-house, except for very, very specialized cases. So it's a very rapid response organization where I'm able to get a question, a colleague will answer almost the same day. Dealing with Academy of Perio, or I'm very active in the Academy of Osseointegration, there it's committees and things like that takes much longer. iADS is a rapid response group. They've been extremely supportive of its members during this close down, and we've had our noontime coffee clutch, and it's been very, very fun and exciting. I always learn at least 3 things, and I'm happy to have participated in it.
Well, Jack, you've been a wealth of information. You told me when we started out that you're kind of shy and you may not have much to offer, and of course, have a. I understand the irony. That's a tremendous amount of information and great stuff you gave us, and it was just fantastic. And I'm going to let you go and say thanks very much for joining us. And but you know what? I'd like to ask you. We don't usually do this, but I'd like to ask you to come back because I feel like we're just starting to scratch the surface. So will you do that?
David, with pleasure. I've loved you over the years. I love the iADS. And if I could share anything that's a pearl, please reschedule me and we'll have plenty of time to do it. Thanks.
Okay.